Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us here. Our guest today is returning to talk with us, Dr. Kelly Ryan, managing the sports medicine curriculum for residents, and she also provides medical coverage for the Maryland Thoroughbred Horsemen's Association at Laurel and Pimlico racetracks. And she's here today to talk with us about her role as a provider for these athletes involved in horse racing, as well as concussion policies that some racetracks have and others don't. Welcome back to Health Professional Radio, Dr. Ryan.
Oh, thank you so much for having me back.
Great. Glad to have you here. You know, when we were here before, you told our listeners a bit about your background, but for those who aren't familiar with you, why don't you tell us about yourself and how you came to be involved in this very special type of sports medicine?
Yes, it's a very unique field of sports medicine, no doubt. But I actually got into the sports medicine world. I was an athlete myself. I grew up doing gymnastics, coaching, a number of other sports, played lacrosse in college, and thought, well, what better job to have than to be a sports doctor? And then when I was finishing my fellowship with the University of Maryland and MedStar Sports Medicine, I was looking for a job, and there was a contract that had just come up where they were going to be working at the racetrack, and they needed a physician. I had gone to the racetrack with my father when I was growing up, just watching the ponies and things like that. Yeah. But I really had no idea specifically what type of sports medicine I would be getting myself into at that time. I was thinking maybe they might need more like a trauma surgeon there. But the sports medicine model has actually worked out really well at the racetrack, and I think that we've been able to make a lot of improvement in a very short period of time, and just kind of learning as we go.
Now, you're providing support and coverage, medical coverage, at the track, not only to the jockeys as athletes, but there are other employees there who are involved intimately with the activities that go along with the races. Do you see any injuries that mimic those that some of the athletes get while they're racing? For instance, head injuries, concussions not due to riding the horse, but maybe a kick from a horse or something like that. Do you provide coverage there as well?
Yes, absolutely. It's actually, although we are sports medicine, so we like to talk. Concussion is kind of the hot topic, but we do a lot more than just concussion management and taking care of the jockeys at the racetrack. So for people who have no experience of being at a racetrack, there are people who actually have to take care of the horses throughout the day. They're called the backstretch employees. There's also trainers and owners that are, very much involved with managing and taking care of the horses. A lot of people are riding. It's very physically demanding. A lot of manual labor. They're constantly walking the horses, feeding them, grooming them, all those types of things. And all of those are really actually big occupational hazards. I have patients come into my office. They've been kicked by horses. Mm-hmm. They've been bitten by horses, have been head-butted by horses and had concussions. They've been thrown off of horses. They warm up the horses in the morning, exercise riders, those type, we see all of those types of injuries, and we manage their blood pressure, and we manage their diabetes if they need help with that type of thing. If they have a cold, we'll see them. The other thing is that there are some people who are working at the racetrack continuing to do physical labor that are in their 70s, even upward to almost 80, and they've been doing this for their entire life. So there's a lot of arthritis that's at the racetrack as well. So we also manage those types of issues. We do a lot of injections for a lot of our patients to treat a lot of their arthritis. So there's a number of different things that we can do from a sports medicine standpoint and from a primary care standpoint rather than just managing concussions. We also had a health fair where we did our flu vaccines and tetanus vaccines because, believe it or not, horses actually can carry tetanus in their mouth. So if they were to get bit by a horse, it actually can be very dangerous.
So not any of the hazards that you'd find on the basketball court, right? None of that.
No, it's been a learning process for sure. And there's not, it's a very much a hidden world, and there's not nearly as much research about the racetrack as there are in other sports. You know, they don't have, while it is a very high money making industry, the people who work at the racetrack are just really hard workers, and you know, it's not a glamorous place back there in the stables. You know, it is up there in the grandstand, but not in the stables. No. A lot of really hard-working people.
You know, you're talking about some of the research that's been done in some of the other sports, namely the NFL, especially as it has to do with concussions, concussion safety, recognizing concussions, proper diagnosis and whatnot. Back about a year or so ago, there was an article concerning the state of Maryland and how they're focusing on concussion safety for their jockeys. In your experience, how much input do you have to determine when a jockey is ready to get back on the horse, and how much influence does the track have? And is that influence the same across the board, no matter which track you're at? I mean, you've got standards as a doctor. Do the tracks have standards concerning concussions and other head injuries?
So this is actually very much a big debate, and it's really been a big issue for us specifically. So what happened was, we got to the racetrack, and we're used to taking care of concussions. That's what we do. We take care of concussions all the time, and you know, MedStar does actually take care of the Baltimore Ravens, and that's part of my training. And our medical director, Frank Dawson, he does work with the Baltimore Ravens. So we come from those types of standards. We come from NCAA type of standards, where there's no question, these are the rules, and this is what you follow, and this is how you manage a concussion. When we got to the racetrack, there was nothing like that. Again, we are really the first sports medicine group to be at the racetrack. So a lot of this information is new to them. They live in this very secluded world, and they really haven't had much from the medical world paying attention to them at all. So when we got there, it was standard of care for us taking care of athletes that we have a concussion protocol, and that we have some type of guideline and standards that we know to take care of and manage concussions. So when we got there and there was nothing there, we said, well, how is this going to work? So interestingly enough, at a racetrack where there are referees in other sports, there's actually stewards at the racetrack, and they are really the people who make the rules. And so MedStar went to them and said, this is how we treat concussions, and if a rider comes off, this is what we're going to do. And if we suspect that they have a concussion, then this is how we're going to manage it. And they were on board with us, and they said, you're the physicians, we will support you. This has never been done before. This is completely new, but we will support you. So we've been working really closely with our racetrack, and the way that we put it is, if a jockey gets back up on a horse and is riding and could potentially be suffering from a concussion, it affects their depth perception, it affects your reaction time. So you could potentially make a move in a very close situation with horses running 40 miles an hour, and the horses could what they call clip heels, or you could potentially run into one of the other jockeys because you're not as good as you should be.
Up to full speed.
Yeah, and a concussion is bad, but there are much worse injuries, such as, paralysis and spinal cord injuries and other significant trauma and even death if those horses go down. Someone could potentially be trampled. And so, riding a horse with a concussion could potentially be like riding a horse drunk. And so they were on board. And so that's what we do, and that's how we manage concussions. And we went in there, and we had a little bit of resistance when we first got there because it is a complete culture shock. Mm-hmm. These guys were used to, and these guys are, and gals. We also have multiple jockeys that are females and exercise riders and things like that. But they're tough. They're some of the toughest athletes I've ever worked with. They work hard. It's a lot of stress on their body riding horses like they do. They've had a lot of really significant falls. But when you educate, and luckily, there has been a lot of press out there from the NFL and, from, youth soccer and things like that, people are starting to recognize the importance of concussion management. And so we gained their trust, and now they come and see us, and we haven't really had anybody give us any pushback.
Now, where can our listeners go and get more information about MedStar Health?
So medstarhealth.org, and we also have a Facebook page for MedStar Sports Medicine, which is our sports medicine division of our group. And then there's also some good information just for equestrian riders from the CDC Heads Up. And then hopefully we'll also be continuing to work on spreading that information because, again, we're one of the only tracks that are managing concussions like this way. So we're trying to spread our word across to the other racetracks and trying to form a more cohesive group across the country.
Well, thanks for coming in today, Doctor.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in studio with Dr. Kelly Ryan. We've been talking about concussions and concussion policy as those policies relate to the horse racing industry. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to the cast on iTunes, listen in, and download at SoundCloud.